Sometimes ignorance is bliss, but not when it comes to heart disease. Only about half of women recognize heart disease as the number one killer of women. Many women still don't know exactly what heart disease is or what it looks like. When you think heart attack victim, you may picture an overweight, middle-aged man gripping the left side of his chest, then falling to the floor. Women are more likely to suffer from back pain, jaw pain, or nausea before a heart attack, according to American Heart Association. Here are the 8 things you probably don't know about the number one killer of women, but absolutely should. WOMANELY. Number 1. Heart disease kills more women than all cancers combined. An estimated 1 in 4 women dies from heart disease. Breast cancer, on the other hand, is the cause of death for 1 in 30 women. Number 2. 9 out of 10 women have at least one risk factor. Underlying heart conditions, birth control pills, smoking, a poor diet and a lack of exercise can all contribute to heart disease in women. Number 3. Routine screening should begin in your 20s. 60% of women thought heart screenings weren't recommended until after age 30. Experts actually recommend that screening should begin at age 20. Number 4. Symptoms are really hard to recognize, especially in women. Women tend to have more subtle symptoms like fatigue, nausea, shortness of breath, indigestion, back pain, even jaw pain before heart disease. Number 5. Bystanders are less likely to perform CPR on women. Women are less likely than men to receive CPR in public during cardiac arrest. The data showed that 45% of men receive bystander CPR in public compared to only 39% of women. Number 6. You don't need to do mouth-to-mouth to deliver CPR. Check to see if the person is responsive. Call 911. Push hard and fast on the center of the chest. Hands-only CPR is just as effective as the mouth-to-mouth variety. Number 7. Being fit doesn't mean you're off the hook for heart disease. A common myth is that heart disease doesn't affect women who are fit. Things like overeating and a sedentary lifestyle increase your risk of heart disease. Number 8. Even if you don't have symptoms, you may still be at risk. Roughly 64% of women who die suddenly of coronary heart disease reported no previous symptoms. Women need to pay attention to their heart and notice if the activities they normally do are suddenly more difficult. If they are, consider getting your heart checked. Exercise is sometimes the best way to monitor how you feel by assessing how much activity you can do.